I'm Dr. Nicole Patterson, and I'm the program director for the PTA program at Central Penn College. I'm here today with some of our other staff, and I'm going to answer some of your questions about physical therapy. I first heard about physical therapy when I was in middle school, and my dad was injured during a biking accident. He injured his shoulder and required surgery and had to go to some pretty extensive physical therapy after that. So seeing the progress that he made and being able to get back to all the things that he wanted to be able to do, really that kind of got me started thinking about physical therapy as a profession, and sort of intrigued me about what I could do to try to help people. To get a PT degree, they are all doctorate programs now. So I first got a bachelor's degree, so I have my bachelor's in biology, and then I went on to PT school. I went to Slippery Rock University for 3 more years after college, and I got my doctorate in physical therapy. And so that is the path for physical therapists. The path for a physical therapist assistant is typically a 2-year associate program. So you can come right out of high school and begin that program. Part of all PT and PTA schooling is doing internships. So my last year of PT school was spent doing internships, and I saw a variety of sites during that time. I spent some time in a VA hospital in downtown Pittsburgh. I worked at an outpatient center in the suburbs of Pittsburgh, and I also worked with the intermediate unit where I went into schools and I treated kids everywhere from preschool up through high school who had different conditions. So I got to see a lot of different patient types during my training. My first job out of school was at an outpatient center that was affiliated with a hospital in Maryland, and I worked there for about a year or so, and then I've pretty much worked in outpatient orthopedics ever since. That is sort of my passion, and I've found some different niches in there. So I worked at a place that had a pool, and I did a lot of aquatic therapy there, and that is something that I love still, and I think it's amazing. I also got into a little bit of women's health and lymphedema treatments right before I came to teach here. Teaching has always been a passion of mine, and so when this opportunity arose, that's what I wanted to do as well, so I can do a little bit of both. So in our pool, we did pretty much all the same things that you would do out on what we call out on land exercises, but we just adapted them to be in the water, and we used the properties of water to make it more beneficial for our patients. So you float in water, and so that helps our patients who have conditions like arthritis, where their joints are starting to deteriorate and it hurts to be up and walking around because their hips and their knees hurt. But when you put them in water, it makes them a bit more weightless, and they can do exercises much more comfortably in the water than they could out on land. We can also do resistance training in water. You can turn on jets and work against them. And then water also exerts a force, so if people have swelling or things like that, the water can help to relieve some of that as well. So there's a lot of great properties of water, a lot of beneficial therapeutic properties of water, and it's fun. Most people like it. They get to go swimming and do their exercises. There's been all sorts of stuff. Healthcare is sort of a crazy pendulum. We've seen a lot of changes in reimbursement, which have sort of changed the way we've had to practice, but it's really all about being adaptable. So you have to sort of just go with those changes, figure out new ways to make things work, and still keeping our patients' best interests at heart. So making sure that we're still taking care of the patients, getting them back to what they want to be able to do, while still maintaining that balance of getting paid for our services and keeping the clinics afloat. I would say if you ask any therapist that question, the answer is probably going to be, most of the time, seeing our patients improve, seeing our patients hit milestones that maybe they didn't think they were going to reach, being able to do something that they thought they might not ever be able to do again. Just watching them improve, get back to their activity, their sport, living independently, whatever the case may be. But when you see that and hear from your patients how appreciative they are of the help that you've given them along the way, that's kind of what keeps us going. A good PTA is someone who is kind and compassionate, caring, hardworking, and really has the patient's best needs at heart. Someone who is dedicated to helping others and getting them back to being able to do what they want to be able to do. So PTA is an in-demand field. According to the Bureau of Labor and Statistics, the field of PTA is expected to grow over the next several years. And PTA is a great degree to have. It's quick. It's much quicker to get a degree in PTA versus a PT degree, which means less schooling, less debt. You can get out into the workforce a little bit sooner. And you still get to do all the fun part of therapy, which is actually working with the patients. So that is a reason that some people might choose PTA over PT. So if a PTA would decide to go on to become a PT, there are several bridge programs that can help with that. You do need a bachelor's degree, so after getting a PTA degree, you can go on, get your bachelor's degree, and apply to PT schools. Central Penn College has recently started a bridge program with Slippery Rock University, which can help with that process. So here's some of the equipment that we use while we're teaching and learning about physical therapy. So we have some fairly standard gym equipment. We have a bunch of weights and TheraBands that patients can use for strengthening. We do have a bit of gym equipment here. We have some stationary bikes. Most clinics will have some sort of aerobic materials like that, usually like treadmills, ellipticals, things like that as well. We've got several full-size skeletons for students to learn all of the bones of the human body. We're very anatomy-based, so bones and muscles are really, really important to what we do on a daily basis, so that's definitely something that you'll learn about in school. We have this lab sort of set up like a clinic, so we have a lot of treatment tables over here. We have a lot of the machines that you'll see in the clinic. We use these to help patients for lots of different treatments and lots of different conditions. For example, we have a patient here who has a shoulder injury. We're using heat and electrical stimulation to try to decrease her pain, which will hopefully then improve her movement, allow her to do some strengthening exercises, and again, get back to what she wants to be able to do. I just think that this is a field that will never go away. It's very rewarding to work in this field. It's fun. It is demanding, but there are a lot of different options for you in this field. You can work with all age ranges, from babies to adults and geriatric patients. You can work in a variety of settings, hospitals, outpatient facilities, schools, nursing homes, patient homes. So it never gets boring. There's always something new and fun in the field of physical therapy, so I highly recommend it.